Welcome back to the Explainer. Imagine stepping into a busy gymnasium. You know the drill. Balls flying everywhere, sneakers squeaking, energy literally bouncing off the walls. Now, to the untrained eye, that just looks like playful chaos. But for a really effective physical education teacher, that gym, it's a clinic. And you? Well, you're the movement diagnostician. Today, we're putting a spotlight directly on Competency 004, Diagnosing Immature Movement. We're going to explore exactly how you can cut through all that noise, watch how a student moves, and instantly know exactly what they need to succeed.
Okay, let's dive right into this. Here's our syllabus for today's mini masterclass. We'll start with the Movement Diagnosis Challenge, then decode immature patterns, walk through a 30-second movement scan protocol, look at a case study on the overhand throw, adapt things for different grade levels, and wrap up with why precise diagnosis matters so much. So, Section 1, the Movement Diagnosis Challenge. Let's be real for a second. The reality of teaching PE is that your students are rarely, if ever, going to arrive with fully developed, mature movement patterns. They're still growing, they're figuring out their bodies, and honestly, their coordination is completely a work in progress. Which brings up a really frustrating question, doesn't it? Why do some students just plateau? Look, if you've ever watched a student practice a skill over and over again without making any progress, you know the absolute frustration of wasted reps. I mean, when a student's form just isn't clicking, doing the exact same flawed movement 50 more times, it's not going to help them. Honestly, it's probably just cementing a bad habit. And that brings us to what I consider the absolute golden rule of this entire explainer. Diagnosis precedes correction. Before you even think about adding more repetitions or telling a student to just try harder, we have to increase clarity. You literally have to know what's broken before you can even begin to prescribe effects. Now, this whole idea is formally captured in Competency 004, specifically descriptors D and G. Officially, it's defined as analyzing observable behaviors to identify immature patterns and designing developmentally appropriate corrective progressions. Sounds super academic, right? But what it's really about on the ground is practical classroom diagnosis and targeted cueing. It's simply evaluating a movement, pinpointing what needs a little tweaking, and applying the right instructional strategy to fix it. Moving into Section 2, decoding immature patterns. So how do we actually spot these issues on the fly? Well, we need to learn how to identify these specific, observable symptoms of uncoordinated movement right there in real time. Because every single observable symptom connects directly to a root cause. Think of it like a giant puzzle. See a student taking a same footstep during a throw? That signals a lack of oppositional coordination. Seeing more of a pushing motion instead of a nice, smooth, overhand arc, you're likely looking at weak trunk rotation, or maybe they just don't understand the arm pathway yet. A stiff-legged landing? That tells you right away there's limited knee flexion and poor shock absorption. And head-down dribbling? Classic signal of underdeveloped spatial awareness and low confidence in their ball control. Oh, and here is one final, absolutely crucial symptom to watch out for. When you see no follow-through, what you are really seeing is an incomplete sequencing of the movement pattern. It's so fascinating because a trained eye can spot this breakdown almost instantly. The movement just abruptly stops, which means the physical energy isn't transferring the way it's supposed to. Now, knowing all these symptoms is fantastic, but you need a systematic way to apply it when the gym is loud and chaotic. And that brings us to Section 3, which is really the hero of our story, the 30-second movement scan protocol. What's really interesting about this protocol is that it's a rapid, real-time strategy. You can use it without ever disrupting the flow of your class. It's literally just 4 steps. Step 1, observe 3 attempts. Seriously, don't jump in after just one mistake. Watch and see if it's actually a consistent pattern. Step 2, identify just one missing component. Step 3, formulate one single corrective cue in your head. And Step 4, design one really short isolation drill. You know, the true beauty of this 4-step process is that it completely prevents overcorrecting. You've got to keep your instruction laser-focused, making small, single-issue adjustments rather than trying to overhaul a kid's entire technique all at once is the secret to maintaining their momentum. I mean, think about it. If you give a student a laundry list of 5 things they're doing wrong, they're going to freeze up. Just give them one clear, focused adjustment. All right, let's look at Section 4, a case study on the overhand throw. Let's take all this theory and shift to a practical, real-world clinical case to see the protocol in action. And this brilliantly illustrates exactly what we've been talking about. First, we observe the behavior. The student is facing the target squarely and stepping with the same foot as their throwing arm. Instantly, boom, your diagnosis kicks in. They are missing that oppositional step and trunk rotation. See how that works? The visual symptom directly maps to the specific mechanical diagnosis.
Right, so now we write the prescription based on that diagnosis. Our corrective cue needs to be super simple and focused, so we go with side, step, throw. In our isolation drill, we set up a step-only drill along a taped line. Think about the sheer brilliance of this for a second. We are actually removing the ball entirely just to isolate that footwork first before we reintroduce the whole shebang. We identified one missing component, gave one cue, and designed one drill. Perfect.
Moving along to Section 5, adapting for grade levels. Because, well, our patients age, right? And our diagnostic tools and teaching methods absolutely have to evolve with them. What works for a kindergartner is definitely not going to fly with a fifth grader. So, differentiating your instruction is key here. For your kindergartners and first graders, you want to focus heavily on isolated movement components and use really big, exaggerated teacher-led cues. As they move into grades 2 and 3, you can start integrating 2 components at a time and introduce some basic partner feedback. And by 4th and 5th grade, shift the responsibility entirely. Encourage self-analysis and give them peer observation checklists. Basically turn them into little mini diagnosticians themselves. Which brings us to our final stop, Section 6, why precise diagnosis matters. Let's look at the resolution of this entire framework and why it's such a real game changer. So the crucial point here is that this approach is a massive win-win for everybody. For you, the teacher, developing these quick diagnostic skills prevents wasted repetition and vastly improves your instructional precision. You aren't just guessing anymore, you're applying targeted fixes. And for the student, well, targeted corrections significantly reduce their frustration. It builds visible improvement quickly, which directly spikes their confidence and engagement. You preserve the momentum of the class while actually facilitating real, visible growth. I want to leave you with this final, thought-provoking question. How will you change your next 30 seconds of observation? Diagnosing immature movement isn't just some textbook theory. It's a foundational, practical skill. The next time you step into that gym, don't just watch the chaos. Observe, isolate, and prescribe. You will be absolutely amazed at how quickly things fall into place. Thanks for joining me on this explainer, and I'll catch you next time.